Good afternoon and welcome to today's program titled Trans 101, Making Treatment Safe for Transgender Clients. I'm Julia Brown, Associate Editor of Addiction Professional. Today's program is a Foundations Recovery Network webinar sponsored by Millennium Health. Thank you to our sponsor and to those of you in our audience today for giving us your time and attention. Before we get started, we have just a few housekeeping details. Each window on your screen can be moved by clicking and dragging, or enlarged and minimized by clicking the icons in the top right corner of each window. Please use the Q&A area to the right of the slides to submit a question at any time. If you cannot see this area, simply click the red Q&A button. To download a copy of today's presentation, please click the link in the resources area in the lower left of your screen. If you have any technical issues during the program, please click the yellow help button to troubleshoot the issue. A special note about CE credit. To receive credit for today's program, you must click the green CE certificate widget at the conclusion of the program and complete the evaluation form. If you are watching today's program in a group, please download the group submission guide and program evaluation form located in today's resources list and follow the instructions. If you have any issues with this process, do not reach out to today's sponsor as they will not be able to assist you in receiving a certificate. Please note, CE credit is not available for the archived webinar. It is only available for the live event. Finally, you can also tweet during today's webinar using the Twitter widget by clicking on the blue Twitter icon at the bottom of your screen. Simply click the Post and Authorize buttons to log into your Twitter account and begin sharing automatically at the event hashtag #APLiveWebinar. At this time, it is my pleasure to introduce our speaker, Beck Gee-Cohen. Beck is originally from Los Angeles, California, and completed undergraduate work in the field of sociology with a focus on gender, sexuality, and addiction from Montana State University in Bozeman. Beck's undergraduate thesis was a study on addiction in LGBTQ rural communities, and Beck's master's degree is in addiction studies from Hazelden. Beck has facilitated trainings and given lectures around the country at conferences, prisons, schools, treatment centers, and everywhere in between, focusing on LGBTQ communities and making addiction treatment better for these clients. Thank you, Beck, for taking the time to speak with us today. With that, the audience is yours.
Thank you so much. Hi, everyone. This is Beck, and I'm so grateful to be here today and to be part of this webinar, and thank you all for joining me, and we're going to have fun today, as much fun as a webinar can be. If you have any questions, you can always email me, bg@therefugeahealingplace.com. I'm the Northeast Business Development Rep for the Refuge in Florida, and feel free to email me anytime. So let's get to it. I want to start off by talking about the pieces of a foundation, and I want to disentangle all of these to start because I think it's important when we're talking about transgender clients. So we'll just start with that. So when people are born, they're assigned a sex at birth, and we have to talk about natal sex in a way that we are assigned. A doctor assigns us our sex at birth, and it's different from gender. So what we can be assigned at birth, we can be female assigned, we can be male assigned, and we can be intersex assigned. Now, many people don't know what intersex is, and I don't want to go into it too much, but the definition is a variety of conditions in which a person is born with a reproductive chromosomal or sex anatomy that does not seem to fit the typical definitions of female or male. And the doctor is the one who decides, and it's pretty, there's no regard to where someone is female and where they are male. It's very much a decision of the doctor if the person is assigned intersex at birth. But this is totally different than gender. Our gender identity is an individual's internal sense of being male, female, both male and female, neither male or female, or something else. And since gender identity is internal, one's gender identity is not necessarily visible to others. And this is very important with the ongoing conversation that we're going to have today. And people's gender identities, they can be, they can identify as woman, as man. Under the transgender umbrella, they can identify as agender. And I also want to say that there are so many more gender identities. And one of these things that I like to talk about is the gendering of Facebook. Now, a lot of us have Facebook. Maybe some of you are on it right now. And about 3 years ago, when you went on Facebook to create a profile, you had two choices, male or female, and that was it. And so I like to tell this story because when I was getting married, I had identified as female under the Facebook profile. And what was happening is that the advertising that was coming up was very female-oriented. Like, did you pick out the right dress? Did he get you the right ring? What about your bridesmaids? It was very geared toward what I would identify as female-oriented. And so what I did was I changed my gender marker to male. And a couple of things happened. One, my LGBT community embraced me and said, "Oh my gosh, you're finally transitioning. This is so great, blah, blah, blah." The second thing that happened was that my mom called, and one thing I learned is not to be friends with my mom on Facebook. But what really happened is that the advertising went to a more predominantly male-oriented way. So I was getting advertising that said, did you get the right suit? How about these shoes? Things that were geared toward things that I liked. But a couple years ago, Facebook did this extraordinary thing, and it had a drop-down menu. And what happens is that this drop-down menu allowed for 58 other gender identities that one could be. And so I think that's very telling especially for young people who identify not necessarily male or female, but maybe somewhere in the middle, or maybe as trans, that they could actually have an identity that placed them in this Facebook world as who they wanted to be. And so that means a couple of years ago we started actually having this conversation about gender and how we can be better at identifying gender in the web world, I would say. So transgender umbrella terms, I just want to get toward this. You're going to hear me say today transgender a lot, or trans man and trans woman, and I think it's really important to decipher what those mean. Transgender obviously is an umbrella term. It's people whose gender identity or expression behavior is different from those typically associated with their assigned sex at birth. And again, it's used as an umbrella term for most of the community. If I say trans man, I'm talking about a trans individual that identifies as a man or masculine, and trans woman is a trans individual that identifies as a woman. Some people we might have coming into our spaces identify as genderqueer. Some identify as transsexual. Now, transsexual, I get a lot of questions. What's the difference between transgender and transsexual? Well, transgender is an older term. It represents those who have or may be medically transitioning. And if I have a client that comes in who identifies as transsexual, then I'm going to use that word right back. So, but a lot of times I just say trans, and that typically works for most people who identify with the trans community. Here's some more terms that may come up when you're talking to a client: bigender, agender, gender nonconforming. Individuals that whose gender expression is different from societal expectations. Two-spirit, and if anyone who is working with Native American cultures may hear the word two-spirit, and that those characteristics are taking on both spirits of masculine and feminine. And then I want to separate also sexual orientation. And it's important to separate sexual orientation from gender identity because so many trans people get put into being part of the LGBT community, which automatically places them as lesbian or gay in a lot of terms. Sometimes trans women are seen as gay men, and that's just not right. So a lot of trans people actually identify as heterosexual, and so sexual orientation is completely different, and we need to make sure we take that apart. So sexual orientation is an individual's physical and or emotional attraction, and sexually or emotionally to someone with specific genders or sexes. So, you know, people who identify as sexual orientation, lesbian, gay, bisexual, straight, asexual, pansexual, and queer. A lot of people don't know what pansexual is, so I'll just kind of tell you what that means. And the pansexual flag is pretty awesome. It says hearts, not parts, and I think that it's those people who connect emotionally to the person and the spirit of the person, not to their genitalia. So I want to talk about gender presentation, how one expresses themselves to the world, and this is really important because this is upon first meeting someone. When someone walks into our office, we automatically place them into a box of male or female or even question mark, right? So it's really important as we talk about trans people or gender in general, when someone walks into our office and may be presenting as male, do we automatically assume that they're male? Do we automatically assume that someone who walks into my office that appears female by societal standards, are they female? And do we just run with that? Or do we even question it, or do we even ask the question about gender in treatment? And because a lot of people that I know who are trans, they walk in the world, maybe some trans women walk in the world and they look like men during the day to make money, to go to their job, to put on a show in order to survive, and then they go home at night. Maybe they express themselves differently behind closed doors or think of themselves differently. It's really important to have that conversation with them because our presentation doesn't always match up with who our gender identity really is. So some ways that people present themselves: female presenting, male presenting, androgynous, no gender, gender nonconforming. And then the last one, sexual behavior. And sexual behavior is what someone obviously engages in their sexual practices, and it's really important to talk about, sexual behavior doesn't always match up with sexual orientation. A lot of us know people in our offices that come in maybe who have drug addiction and have had sex, like men who have sex with men for drugs, or even men who have sex with men for pleasure, don't always identify as gay. They could identify as straight, and that's okay. So I just want to extrapolate all those 5 things, and because they often get conflated when we're talking about trans people and just people in general, because we put them into boxes, and I just threw out a bunch of labels and a bunch of boxes, but hopefully you can kind of see how we can individualize people by just all of these different foundations of what makes up a person. So today I'm going to talk about cisgender, and if you don't know what that is, I'm going to tell you right now. And the definition of cisgender is to be one with. So someone who identifies with their natal sex that they were assigned at birth. So 99% of the world is cisgender. Okay, so cisgender also meaning not transgender or gender variant. So most of you sitting here on this call today are cisgender, and when I talk about this stuff, I really want to talk about privilege, because if we're sitting in a room where there's a power dynamic, counselor and client, we need to know our privilege and where we stand when a trans person comes into our office, or someone who's talking about questioning their gender. We need to know what our privileges are as cisgendered individuals. So here's some examples of cisgender privilege, and I want to talk about these a little bit more, but the first thing that comes up is bathroom privileges. As a cisgender person, you can walk into any bathroom and be okay and feel safe and not have to worry about being beat up or being yelled at or screamed at. And currently, I was just reading yesterday, currently there's a push for a California initiative for the 2016 ballot to ban trans people from bathrooms and locker rooms. And what would happen is that there would be a $4,000 reward for anyone who turns in a trans person to the authorities. And so it's almost like a bounty, right? So there's bathroom policing happening. And the thing is that there's been no known cases of a transgender person violating privacy in any public bathroom to date. So all of this fear, this trans panic per se, is really all in our heads. And what happens is that, I don't know about you, but when I go to the bathroom, I just need to go to the bathroom. And for trans people, this can be a place of significant trauma. Many trans people have experienced violent assaults that I've worked with in bathrooms. And so when we're looking at our facilities and when we're walking in the world, and maybe when we have someone who's looking for a bathroom that's not gender specific, we need to address that. We need to address that in our facilities, and we need to address the fact that there's fear there. There's an app out there that allows for bathrooms to show bathrooms in certain areas that are not gender specific, and I have to think like, wow, that's a great idea. But again, why do we need to have that? Because people are policing bathrooms, and trans people are hurting, physically hurting because of this whole bathroom issue. Trans people have higher rates of UTIs and bladder infections and things like that because because it's such a scary place. The bathroom can be such a scary place. Same thing with public locker rooms and dressing rooms. And as a cisgender person, you probably walk in the world and don't have strangers asking you about your genitals. Unfortunately, in my experience with working with trans people, a lot of them have had inappropriate questions of strangers just walking up on the street and asking them, if they have had surgery or if they have, a penis or a vagina or what that looks like. And it's so violent, and it's such a boundary issue. And so it's really important to know that you don't have to walk through the world like that, but these people that are walking in your office who are trans have to deal with that on a regular basis. Strangers don't ask you how you have sex. Your validity as a man, a woman, or a person doesn't depend on how well you pass. And passing is a big deal in the trans community, not so much because of the person who's trans, but because of society and what we place on what makes a woman and what makes a man. People don't ask you what your real name is, and I like to use the example of Prince. Prince from Minneapolis, so Prince changed his name to a symbol, and yeah, we maybe thought it was kind of weird, but we went with it, right? We totally went with it. But when someone who's trans wants to change their name or uses a different name, they're constantly asked what their real name is, as to that the name that they chose for themselves isn't valid, which in turn makes them not feel valid. Your identity is not seen as a mental pathology, so a lot of trans people have a diagnosis of gender identity disorder, which we'll get to a little bit later because that's changed in the DSM-5. However, you have to have a mental health diagnosis in order to get hormones, and how stigmatizing is that? And then your gender won't be used against you in court if you were murdered. California is the only place in the country that trans panic cannot be used as a reason to kill someone. And so, not that it always passes, but we used to have gay panic, and now you can't be killed for being gay because someone didn't know you were gay, but you still can use that as a defense in all the states except for California. So some of the struggles that trans people go through, and again, we're going to talk more about this a little bit later, but appearance, body image, hiding or suppressing your gender identity. There's the lack of family and social support, and isolation and lack of connection to a positive, proactive trans community. Also, as we are working with addicts, hormone therapy and injection history. So talk about triggers. If someone is a IV drug user and they're transgender, and then they have to give them shots weekly, themselves shots for hormone therapy, that can be very triggering, and it's something that we need to think about when we're talking to our clients. And usually what I like to do is send them, especially people with a history of injection drug use, is send them to a shot clinic or their doctor to get their weekly shots if that's accessible, because that in and of itself, the ritual around it can be very triggering. Obvious stigma and discrimination in employment issues. A lot of trans people have struggles getting jobs, and I'm a big believer that, a lot of people who come out later in life, they come out later because they are living their lives and surviving economically, and so they don't come out because a lot of trans, especially trans women, will lose their jobs if they come out. So the pronouns that we see for trans people, obviously she and he, they and them is another pronoun usage that we see a lot in treatment and out there. People who don't identify with either male or female identities. And then there's a couple others here, and there's more, but however a trans person identifies, whatever pronouns they want to go by is what we should use to be affirming. And I've had clients who have changed their pronouns every day, and we do the best we can do, and we just identify them as the pronouns that they want. How great is it to be in an affirming institution that allows for a person to be called he or she or they or Z, and we do that in front of the client, with other clients, and also behind closed doors, and on paperwork. It's really important to do that on paperwork. I know it can be difficult in the medical model of treatment. However, all we do is need to make a case note and say this client wishes to go by they and them as pronouns. Therefore, we'll be using they and them going further. It's pretty easy to do. So talking about gender identity versus gender dysphoria, and in the DSM-4, I know you guys are all caught up on your DSM-5 reading, so there's no doubt in my mind that you've read all the way through it. But in the DSM-4, gender identity disorder focuses on the identity issue and the incongruity between someone's birth gender and the gender that they identify. I should say their birth assigned and their gender identity. But this incongruity is crucial to gender dysphoria, except for in the DSM-5, gender dysphoria is really about the importance of the distress about the incongruity. So the distress and the societal views and the struggles it is how it is to walk in the world as trans is really emphasized in the DSM-5. So there's some pros and cons to this, however. So the pros to taking away gender identity disorder means that being trans is no longer a mental health disorder. However, now homosexuality was taken out in like 1972 from the DSM, and we're still seeing it being brought up as a mental health disorder. So there's still, 35 years later, we're still seeing the issues of having a mental health diagnosis for homosexuality, that we're going to still continue to see this happening for trans people, unfortunately. It says it takes away the stigma of being trans. However, only if a clinician, a therapist, sees that in that way, that this is not a mental health disorder, even though many people, there are many therapists out there who continue to identify being transgender as a mental health disorder. And it also identifies that societal discrimination is the cause of depression and anxiety, not being trans. And I think that is very, very important. If I walk in the world as someone who's transgender and I can't find a job and I get harassed on the bus and I can't go to any restroom and all these things, I may struggle with depression and anxiety. It may actually not be a chemical imbalance. The cons to the gender dysphoria diagnosis is that we continue to need a diagnosis in most states for hormones, and not all states have informed consent for hormones, and you also continue to still need a letter from a therapist in order to get surgery. And if a trans person wants to go through that process, they need to go through a lot of hoops and in order to transition. Now, these hoops obviously are for those who can afford it, who have the ability and access to get therapy every week, and that's just not the norm, unfortunately. So you have to get all of this medical, a mental health diagnosis, and you have to go through this process. However, for the most part, most transgender affirming surgeries are not covered by insurance, even though you have to go through all of these hoops. So this is the struggle. And then discrimination cases are more difficult without a diagnosis. So, if I'm discriminated against because I'm transgender, if I don't have a diagnosis of being transgender, I may not win that case. So, real important to look at these cons as well. Let's talk about treatment and the blocks to treatment. A lot of you guys are working in treatment right now, and the most significant block to treatment is gender-specific treatment, and the fact that some gender-specific treatments are not allowing trans people to go where they identify. My favorite thing to ask a treatment center is to see if they work with the LGBT community. And the answer I get, for the most part, is yes, of course, we accept everyone, we love everyone. And then my second question is, okay, so where do you place transgender clients when they come in seeking treatment? And the response I get back most often is, have they had the surgery? So the surgery, I don't know what the surgery is. There's many surgeries if you're talking about gender-affirming surgeries, and what makes someone male or female, and what we're really talking about is genitalia. So it's really important to see a trans person and their identity as the identity that they're saying. Now, the biggest fear I get back a lot is, well, Beck, what if a man wants to is just trying to sneak into a women's treatment facility and wanting to stay with women? And I will tell you, more often than not, that is not the case. You're looking at a 1 in a billion case. I was talking to the DOC in Denver, and one of the fears is if we start hormones in prison, there are going to be a lot of people who are wanting to come to the prisons to get hormones. And I laugh because I don't know about you, but I don't want to go to prison. And I'll find another way to get hormones. So I highly doubt that there are men or women who are wanting to go to the other gendered treatment facilities just to be with women or men. So, again, a 1 in a million chance. But I also ask, because we're really talking about passing and we're really talking about what it means to be a woman or a man, is that if you're asking if they've had the surgery, if their genitalia match their gender expression and identity, then we need to be checking everyone. And we don't do that. We just believe. We just believe and we trust and we start to affirm. I think a lot of it does come from fear, though. The fear that we're not able to understand or be capable of taking care of someone who's transgender. And who really misses out on this is the trans client. Once you start opening your doors to trans people and really working with trans people, I think you'll see the amount of loyalty and the amount of admiration that you get from this community. There's no gender or sexuality exploration in treatment. It's very, very few and far between, and this needs to come across in every treatment: sexuality, gender. You need to talk about what it means to be a woman, what it means to be a man, what it means to be, gender nonconforming, whatever that identity is, and then also talk about sexuality and treatment. And then there's just, lack of resources, and then there's the intersectionality. So we really also need to talk about race and class blocks to treatment. So some of the treatment interventions that I like to go through are these 8. And when I look at this, I can say, oh, yeah, well, we deal with this with everyone. However, and maybe not the transphobia, but shame for sure. I just kind of want to get into the intricacies of working with trans people with these specific topics. So body image, talking about body dysphoria. Not all trans people are dysphoric. Not all trans people hate their bodies or feel uncomfortable in their bodies, number 1. Number 2, some trans people do feel uncomfortable in their bodies. And the impacts of wanting to feel accepted and be complete, what we're seeing a lot in many trans women is buying silicone off the streets and injecting them into their hips and breasts in order to get a more womanly figure. Also, same thing, we're seeing the injection of caulk, like bathroom caulk. And what happens is that, they're injecting that into their hips and their breasts and so that's poison. And all in order to feel more in their bodies or feel more accepted by society. Same thing with trans men. A lot of use of steroids to be over-masculinizing, to build their muscles, to be bigger. And what are our ideas of society of what women are and what men are is really starting to affect people who are trans, who are just trying to fit in. And then using drugs and alcohol in order to get those effects. A lot of many eating disorders, a lot of use of methamphetamine in order to lose or gain weight, or however you need to look. And it's really important to understand adrenal gland system and the effects of hormones on the adrenal gland system. And I'll just tell a quick story. I had a client who would come in on Fridays, and she's trans, and she would come in and she would be crying and crying and crying, and I didn't know what was going on. And what happens is, and I said, finally, I was like, what's happening on Thursday that you're coming in crying every Friday? And she said, well, I'm taking my hormone shot on Thursday. And so when you take a hormone shot, whether it be estrogen or testosterone, is that you get a push of, obviously, of those hormones. And so it was affecting her ability to be present that day. And so we figured out a way to change the individual appointment to a Tuesday so that we could actually talk, and then come up with coping mechanisms for Friday when she was feeling overwhelmed with her hormones. And so it's just really important to think about those things and to address that in a clinical way and to best suit that client. Grief and loss is important to talk about with the trans community. A lot of trans people lose their family and friends. In 2000, I'll give some statistics in a little bit, but in 2014, like 58% of trans people weren't talking to their families. Many people feel the loss of their past identity, but also we need to look at empowering and connecting with that past identity and saying, you know, that person was strong enough to get you to this point. So it's really important to talk about, you know, empowering and talking about that past identity. And then loss of pets. With all the LGBTQ community, I think everyone needs to talk about the loss of pets since they're a significant part of our lives. Talking about sexual health, identifying sexual health concerns, acting out sexual anorexia. Many trans people I know are sexually anorexic, which is just keeping sex away because of for punishing themselves. Safety in sexual situations, talking about being trans prior to the bedroom. It's just to keep them safe is very, very important. And then creating a safe place to talk about sex. You know, sex-positive spaces, kink, sex work, sober sex. Talking about relationships, creating intimacy, establishing or reestablishing familial connection is really important. And then talking about family of choice. With the fact that, like, a lot of trans people aren't talking to their biological families, family is important to the process of recovery. And so whoever that person is, whether it be a sponsor, a best friend, a dog, I don't care, like who it is, like bring that person, bring that being into treatment, allowing for that connection to happen because it's very, very important. Finding safe space. A lot of trans people are socially isolated. A lot of trans people are just trans behind closed doors because it's scary to be out there in the world. And so we may need to think outside the box when connecting. A lot of people maybe don't have access to getting to meetings or even are scared to go to meetings. Maybe creating a space in your office that they can be the person that they want to be and change there. You know, there's so many things that we can do that allow people to start to connect to the world around them, and we may be that first person, that first clinician. And then internalized transphobia and shame is understanding what internalized transphobia looks like. A lot of trans people that I know hate other trans people, and so I have to ask the question all the time of, like, what is it? What's happening for you? Why do you hate trans people? Why do you hate, you know, what's the shame about yourself? And then also finding a space for helping others. A really cool thing about trans people when they come out, a lot of the times they are the teachers. They don't have to be the teachers. They shouldn't have to be the teachers. I think we place them as our teachers, but that's why you're here today, to hear me talk. But I think it's really important for them to get out of themselves and help other people. I've seen really great things when trans people who maybe are going through the process or have been through the process or are further along help someone who's just coming out, and the empowerment is amazing. And then depression, anxiety, understanding the roots of their depression, anxiety. Is it social or is it family? We talked about that a little earlier. And a lot of trans people have a borderline personality disorder diagnosis. A lot of that is trauma. I'm just going to say that right there, is that, and that's my belief. And so when we see a borderline personality disorder diagnosis, instead of pushing it off to the next clinician, like has been known to happen, we need to embrace, and we need to, connect and lean in to that person, because really what's happening is that they've just been pushed away for so long. And treatment to treatment to treatment. If we're not able to connect with, a trans person, if they're not able to get treatment, they're just shuffled to the next treatment, and we can't do that. We can't continue to do that. Trauma, huge in the transgender community. Just all of these things that you're seeing on the board right now is that, the fear of violence, to walk in the world fearful that you could get beaten up, that you could, lose your life. Just some statistics that are really important is that, 22 trans women have been killed this year alone that we know of in the United States. And that is a huge amount of people, of individuals, and most of them trans women of color. And one trans woman is killed every 29 hours in the world. And the significance is that this is less than 1% of the population. And most of the women who have been murdered this year, we see is that they've been stabbed. And what we know about stabbing is that that is close, and it's intimate partner violence that is happening with the deaths of these trans people. And what I think is, and this is of course my hypothesis, is that we put such a stigma on being trans that individuals who love trans people feel that shame, and a lot of the time that shame turns into that self-hate turns into violence, and we end up, this is what ends up happening is trans women end up getting killed. And it is until we lift that stigma and allow people to walk in the world as they are that this violence won't stop. The average lifespan of a trans woman of color is 35 years old. So something is going wrong here in the world around us, and we need to be those people to start setting that, bar higher. We need to be helping these individuals with their trauma, with their addiction, high rates of addiction and suicide for the trans population as well. And I always have to look at it as like, what is my part in that? Because there is a part in our world that has to do with these high statistics. So here's some mental health statistics. You can get them later. I would say all of them are a lot higher. I kind of want to just shuffle through these. But again, 60% were denied health care. And this is from 2014, so this is a new study. And so this is still happening. More statistics here. This is the question that I like to ask too, is that do I need to send my client to specific treatment? There's a lot of great specific treatment programs. Not a lot, but there's a good few in the country that are LGBTQ specific. And a lot of times we send trans people there because we don't know what to do. And there is a place for it, but also I'm a big believer that we can also give and have beds for trans people and allow trans people into our programs, because there are way more trans people that need help than there are beds at specific programs. So if your facility wants to be trans affirming and trans inclusive, it's important to have resources and knowledge and resources for the trans community for ongoing and continuing care, policies in place to affirm identity, sexuality, and gender, and let's just not make treatment traumatic. That's like the number one golden rule, right? So I get a lot of questions about, well, what about the milieu? What about the client's feelings towards trans people? And what I say is that we are models of behavior as clinicians, as staff, and if we are affirming, if we don't allow for people to be discriminated against, and as clinicians and as staff, the milieu will follow our lead, because clients don't really, they're just watching us. They're just watching us, and they just want, they're just wanting their own help, and they're going to find someone to pick on. That's why treatment feels like high school, right? However, if we stop the bullying, if we start being affirming in our facilities, we can totally open up the doors to so many individuals. Having transfamiliar books, and when I say everyone must be affirming, I mean everyone, from whoever's in the kitchen to the CEO to, people who are working, on our plants to, the admissions counselor, maybe having art around. We don't have to paint our, walls with a transgender flag. We don't have to walk around, waving that thing, waving the flags around saying, we support trans people, and that would be great. If you want to do that, that's totally fine. However, when I walk into a space, it takes me 10 seconds to feel safe or not. I can look at a sticker on a wall that says no transphobia here, or an equality sticker, or all, Trans Lives Matter sticker, anything that represents trans people, and I see that, I automatically know, sorry, the snap, but I automatically know that I am safe. And so you can do that too as a clinician and as an institution. So don't assume gender on the first phone call is one thing that we can do as an institution. And not using gendered language, gentlemen, ladies, ma'am, sir, miss, Mr., Ms. When I'm at a restaurant, a lot of the times servers will come up to me and my wife and say, "Oh, hey, ladies," and it's very frustrating. I don't identify as a lady first and foremost. I never have, but I think it's really important to not assume. Don't assume off the first bat. Have more than 2 check boxes, male and female, on all paperwork. If Facebook can do it, you can do it too. Have an all-gendered restroom available. If you have 2 separate single-stall bathrooms and one is male and one is female, pay the $35 and make them both gender non-specific. It'll make life a lot easier, and it'll make it a lot safer, and feeling safety and feeling your anxiety go down when you're coming into treatment is an amazing tool. Having trans health benefits for your employees. If you're trans affirming, you should be trans affirming across the board. And then don't use quotation marks for client's chosen name. And there's an example there of a legal name. You can write legal name, chosen name, and then just don't put the chosen name into quotations, because that means that it's not significant, because it is significant. Affirming clinicians, they talk about gender, they talk about sex, they create an environment of safety and openness, they lead by example. Again, the clients are always watching us. So if we're uncomfortable with trans clients, they're going to be uncomfortable with trans clients. If you have an uncomfortability talking about sex or gender, do your own work. Do your own work as it relates to trauma, and then refer when it's appropriate. If you can't work with a trans client, refer. It's okay. It's okay. And then also allow the story to unfold. I think a lot of the times we think, oh, you're transgender, this is the path you're going to go on. But that's not the only way to live your life. The only thing that makes trans people the same is that they identify as trans. So everyone is individual, but we have to let the story unfold for them. So some resources for you guys, and you guys can get back to this. This is just some some really good books. The gender workbook is awesome. The gender book, for those of you who are working with adolescents, is an amazing resource, so www.thegenderbook.com. And then I Am Jazz is a great book. These are books that you can just have. The Two Spirits, One Heart is written by a mom who has a transgender son. And then here's some more resources for clients and clinicians. The Trans Lifeline. It's a nonprofit dedicated to the well-being of transgender individuals. It's a great phone number. It's trans people answering the phones. Maybe if you have a trans client that you just want them to have the phone number just in case you're not available, they can call and talk to someone. Very important. Jim Collins Foundation funds gender affirming surgeries for trans people who can't afford it. Replace the ACE collects binders for trans men in need so they can stop hurting themselves by binding with ACE bandages. Very painful to bind with an ACE bandage. And then Trans Justice Support Project and the Trans Women of Color Collective, helping to empower trans women of color and creating change. So I think that's it for me. I'm at 50 minutes. I think there's some Q&A coming up. Guess I'll leave it to Melanie, I think, for this.
Thank you again, Beck, for a very informative presentation. Before we get to the Q&A portion of today's event, we would now like to hand things over to Melanie Melcher from Foundations for a few words from our sponsor.
Thanks so much. Here at Foundations Recovery Network, our grassroots movement called Heroes in Recovery has a simple mission: to eliminate the social stigma that keeps addicted individuals from seeking help, to share stories of recovery for the purpose of encouragement and inspiration, and to create an engaged, sober community that empowers people to get involved, give back, and live healthy, active lives. Join us in this mission at our 6K race series at these locations across the country. As a thank you for your attendance today, please enjoy the discount code Webinar 2015 to register for any future 6K event. Back to you, Julia.
Thanks so much, Melanie. We've already had a number of questions from the audience that have come in. However, we would also like to remind you to use the Q&A widget below the slides on your screen to submit a question at any time. So Beck, we have our first question here. How do you suggest handling questions of gender when staff have to complete databases and demographics, since putting the gender of the person prefers will not usually match up with Social Security numbers? Can you talk about that a little bit?
Sure. Yeah, unfortunately, demographically, that's a big issue that they're really trying to figure out on a bigger scale. So now you would have to identify a person's gender identity with their with what their Social Security says for demographic purposes. It's an unfortunate reality. However, if you're doing your own work or process, you can always add those in. If you're doing your own demographic sheets, I would definitely add a space for gender identity in there. But when it comes to higher level stuff, you have to go with whatever is in their medical records. A lot of people do have their gender markers reassigned, though, so I would go with that.
Great. And you talked about restrooms. Is there a respectful solution for public locker rooms?
Well, it depends on the facility. A lot of public, I don't know about you, but the locker room had always been a traumatic place for me anyway growing up, for any kid, I think. So, most trans people, I think, are respectful, and people are respectful in public places. And most bathrooms now don't have, or locker rooms don't have, open showers or anything like that. But how we talk about that is the policies in place. Like Planet Fitness just had a situation this year where a woman was upset that there was a trans woman in the locker room, and what happened was that the woman who had the issue with it was actually asked to leave, not the trans woman, because they had a no tolerance policy for people discriminating against gender identity.
Okay, great. Thank you. Speaking of young adults in high school, our next question is, many students have a hard time with their own identity during that time. What is it like for students, and do they have a more difficult time in this age group versus adults? And do you have any recommendations or strategies for dealing with that?
Yeah, it also all depends. It's very individual. It depends on maybe what school they're going to, or I've definitely talked to kids over the years here, and kids are amazing, and a lot of kids I talk to have no issue with their trans friends, or they have transgender friends, or they have people who are pansexual, or they're identifying as, because they are all coming into their own at this young age and exploring, and so what I've personally come to find is that kids are amazing and resilient, and it's actually the parents and the administration with these kids that are having the struggles in these situations. So the kids are actually really, really amazing when it comes to gender identity, and maybe one day I won't have to do this talk anymore because we'll be past it.
We certainly hope so. You mentioned stickers and making sure if an environment is a safe environment to kind of note so. Is there a resource to obtain those sort of resources or indicators that you can think of or recommend?
Yeah, I would just, the best way to do it is you can Google stickers like no transphobia stickers, or there's because there's so many little resources around. GLAAD has a couple of resources online that you can, or the HRC also has some stuff that you can go to and get some of those stickers just to kind of place in a window. Like I said, no one's ever going to notice. The only person that's going to notice those stickers are the people that are part of that community, so it's a big deal. But yeah, you can just go online and find them anywhere, or even maybe if in your facility create something and pay $15 and get a couple stickers for offices with your logo on them.
Great. That's great. Yeah. And we'll probably take one more question here and then wrap up. How do you recommend going about asking individuals what pronoun they prefer? Is it okay to ask it outright, or is it something that you think should be included in healthcare paperwork and notified to the counselor or treatment professional?
Yeah, totally. I would just ask, but I'm kind of that way as a counselor. I'm like, what pronoun do you prefer? It's real simple, or I wouldn't even say prefer. I'm sorry, it's a little bit late, but I would say, what pronoun do you use? Because it's not a preference, it just is. So what pronoun do you use is just an outright question, and you can actually even put it in your paperwork if you have the ability to do so. You can ask it as a question. Another question that I like to ask upon intake, and I think is very telling, is if you identify as trans or LGBTQ, how old were you when you knew that you were that identity? And how old were you when you told someone? Because if I knew when I was 5 years old that I was transgender, and I didn't tell anyone that I was transgender until I was 30, that's 25 years of holding on to a secret, which is a really great clinical resource, and also very telling of, wow, that's a lot. That's a lot to hold on to for so long. So it's really good for clinicians to know and ask.
Great. Thank you so much, Beck. And that's all the time we have for questions today. We do have some final instructions regarding CE credit. And again, should you have any issues with this process, do not reach out to today's sponsor, as they will not be able to assist you in receiving a certificate. To receive your certificate for today's program, you must click the green Program Evaluation widget, complete the evaluation form, and click Submit. For those watching in a group, as a reminder, please download the group submission guide and program evaluation located in the resources area and follow the instructions provided. For those watching from a mobile device or tablet, you'll need to email the help desk to receive a program evaluation and certificate for this program. Please note that CE credit is not available for the archived webinar. If you have any questions, please click the purple Contact Webinar Help Desk widget at the bottom of the screen. Also, if you enjoyed today's program, please join us on Thursday, January 28th for our upcoming Addiction Professional webinar sponsored by Foundations Recovery Network along with Millennium Health. The program is titled Deepening the Treatment Paradigm and is presented by TJ Woodward. A link to register for the event is located in the resources box on the left side of the screen. I want to again thank Beck Gee-Cohen for an excellent presentation today. I would also like to thank Millennium Health for making today's Foundations Recovery Network program possible. Finally, thank you to all of you in our audience for participating. We hope you'll join us in the future for another Addiction Professional webinar. This concludes today's presentation. Good afternoon and welcome to today's program titled Trans 101, Making Treatment Safe for Transgender Clients. I'm Julia Brown, Associate Editor of Addiction Professional. Today's program is a Foundations Recovery Network webinar sponsored by Millennium Health. Thank you to our sponsor,